I'm Dr. Catrise Austin, Cosmetic Dentist to the Stars, and in today's video, we're going to discuss what are porcelain veneers. Yes, you may have seen some of your favorite celebrities and influencers rocking a new smile with porcelain veneers. Well, if you are at home and you're desiring to change your smile, you're not happy with your smile, we are going to break it down today in this video so that you can decide if you're a candidate for veneers and if veneers are right for you. So let's get started. All right, so what are porcelain veneers? Porcelain veneers are thin shells of porcelain that are designed by your dentist and created by a local dental ceramist to create a new smile. It actually looks similar to like a contact lens. It's like a contact lens for the tooth. Here's a sample of a veneer. It's really thin, and we can have the ceramist design the color, the shape, and the size that we want. And it lies right over the front of your teeth, is glued and bonded to the pores of your teeth so it doesn't come in and out. I love this procedure for anyone who is not happy with their smile. Maybe you're at home and you're not happy with the color. Maybe you have white spots, brown spots, or your teeth have aged and gotten a lot darker or yellow or even brown over the years from all the things that you've consumed, or even just the natural aging process. We can enhance the color and mask any flaws in the color with porcelain veneers. Or maybe you're at home and you feel like when you look in the mirror, your teeth are too short, or maybe your teeth are too long. We can adjust the lengths of your teeth with porcelain veneers. Or maybe you have been thinking about straightening your teeth. Maybe you have some gaps between your teeth, or they're a little rotated or crooked, a little crowded. In some instances, if your teeth are mildly mispositioned, they're mildly rotated, we may be able to create an illusion with veneers to make you get a beautiful smile without having to see an orthodontist and get braces, which could take years. With porcelain veneers, I love the procedure because it can quickly transform your smile. To make a custom-made porcelain veneer, it only takes the dentist and dental ceramist generally about 10 to 14 business days. Each dental lab is different. Some have the capacity, or there's some labs that are larger and they can do the work a little bit faster. But if it's a small dental lab, it might take them a little bit longer. A veneer, when you're talking about the cost of transforming your smile with porcelain veneers, it can cost anywhere on average nationwide, anywhere between, let's say, $1,200 to $1,500 per tooth as a starting point, up to, gosh, in New York City, there are dentists that charge $3,000 and $4,000 per tooth. So we'll just say anywhere between $1,500 to $4,000 per tooth. I know it sounds like a big investment, but it is worth the investment. I'm here to tell you, I even have porcelain veneers. So I think that if you want to quickly transform your smile, is something that you should really consider. Now, if you are on a budget, there is an alternative, I got to tell you guys, and it's called composite veneers. So composite veneers are plastic. So it looks like this. This is a tube of composite, and it's like a putty material. It's actually just like a Play-Doh kind of material. And it's used to do right in the chair. You don't have to wait 2 weeks. Your dentist has this material right in the office, and we take this material, place it over the front of your teeth, and your dentist will hand sculpt it and mold it, harden it with the LED light, sculpt it, shape it, make it look pretty, hopefully, and you walk out the door with your composite veneers. Now let's talk about the advantages and the disadvantages of porcelain veneers versus the composite veneers. Well, basically, one is a plastic material and one is a ceramic material. So let's just do an analogy of a plastic plate versus a porcelain or china plate. You know that plastic plate is not going to be of quality, it's not going to be as strong. It may chip and tear a lot easier. It may bend and not really hold its durability. The same with the composite veneers. With the porcelain veneers, you're investing in a strong material that is going to withstand forces, the chewing forces. It's going to come with the glaze. It's going to be glossier and more lifelike. It is going to not pick up staining. Unlike the composite veneers, over time it can really change colors if you drink a lot of coffee, tea, smoke, drink red wines. If you bite into something the wrong way, it could chip a lot easier. So you may end up reinvesting in a composite veneer or repairing and polishing a composite veneer a lot more frequently than you would if you invested one good time in porcelain. So when you're thinking about the pros and the cons, you have to think about how long you're going to get your investments worth. The advantage is with the composite veneers, you walk out the door in one visit. With the porcelain veneers, of course, you have to let the lab create your new smile, and that again may take anywhere between 10 to 14 days. So in the meantime, you have to wear temporary veneers, and they look great. So it's just a little in-between phase, but what I love about the temporary veneers is you get to try out your smile and see how you like it. And if you want to change the shape or anything, the color, you can see how it fits in your face and then make the necessary adjustments if need be. Once you get the composite veneers, that's pretty much it. You can, make some chair side adjustments if you don't like what you see with your dentist. But I love the porcelain because you do get to be a little bit more involved with the process. And we also get to give you the ability to do a trial smile. The first thing that you guys want to do if you're thinking about porcelain veneers or even composite veneers, I only do porcelain veneers because I like to just do the best. The first thing that you want to do is set up a consultation. And with the consultation, your dentist is going to do an x-ray, do a clinical exam to make sure your teeth are healthy enough to actually get veneers on your teeth. You can't have gum disease, you can't have cavities, you can't have large existing fillings on your teeth already. Those are disqualifying factors. Your dentist is going to discuss what you want out of your smile, what color you want, what shape you want during the consultation. Maybe you have a picture of your old smile and how it used to be. Well, you can bring that to your consultation, and so your cosmetic dentist can design your smile the way that you want it. Or your dentist can make suggestions and show you some new smile styles. Teeth come in different shapes and arrangements. You can have teeth that are round, square round, or completely oval, and that's usually determined by the shape of your face. So if you have a square face, then we want to kind of add some squareness to your teeth. If you have an oval or heart-shaped face, then we probably want to round out the corners of your teeth to make it look natural. That's the name of the game. When we do these smile makeovers, we want it to look natural. So you have a role. You have a role in this process to decide what you want the ultimate outcome to be. And I like that. I love designing the smile with the patients and then giving you exactly what you want. I want you guys to stay tuned for the next video where we're gonna go deeper into the porcelain veneer process and let you know what you can expect. I've been through the process myself, so I know from a patient standpoint everything that you need to know and need to expect for the procedure. So stay tuned. I'll see you in the next video.